going to be discussing herpes this morning on Tea or Coffee. And we have himself, the original, the real savvy Dr. Damien Ava. So Dr. Damien Ava is a board-certified practical medical doctor with expertise in sexual health, of which he is a member of the International Society of Sexual Medicine. He's an award-winning health educator with 2 years running back-to-back, 2018 and 2019, for the Social Media for Social Good Award. He leverages on social media to promote health literacy and positive health behavior change. Good morning, Dr. Damien. Thank you very much for joining us in the studio this morning. How are you doing?
Very good, thank you.
Yeah, so I was looking at your Instagram page and I can see why you won that award, because I have to give it up to you. Your work there is amazing. Well done. Well done.
Well done. Okay.
All right.
So talking about herpes, and I've been trying to understand what exactly herpes is. So can you please educate us? What is herpes?
Okay, so I'll try to be as very pedestrian as I can.
Yeah.
So herpes is a highly contagious viral infection, okay, that is caused by the herpes simplex virus. And it manifests clinically as, an eruption of clusters of rashes. The rashes are filled with fluids. And, characteristically, they also present with a tingling or burning sensation. That's maybe a very, how will I put it now? A simple explanation of what herpes is. Okay? But it's caused by the herpes simplex virus. And when the rashes erupt, they are filled with fluid, and they usually, typically, you tend to feel this very tingly or peppery sensation when you have the rashes. It's one of the commonest viral infections that affect man.
Okay.
The commonest, one of the commonest. So, yes, that's that about herpes.
Yeah. So is it predominantly a sexual transmitted infection, an STI, or can herpes, is it predominantly an STI?
No. So there are two types of herpes, okay? So there is the genital herpes, and there's also the oral herpes. That said, there are non-sexual transmission even for the genital herpes. Genital herpes is predominantly transmitted sexually.
Okay.
That said, there is also non-sexual transmission of herpes. Coming back to the the oral herpes. Oral herpes is the one we call cold sore, the fever blisters that typically affects the mouth. Okay, when you have fever, malaria. Some people call it malaria. They say it's malaria.
Yes.
When you have malaria or some other stressful event, you can have an eruption of the blisters, on your lips or even in the mouth. Sometimes, as far as even reaching the pharynx, can be that serious.
Wow.
Okay, so that particular type now, you can actually have non-sexual, because it could be actually a harmless kiss. Somebody gives you a harmless kiss or peck, or maybe even shared contaminated cutlery.
Spoons.
Spoons. Somebody that has the infection, and the virus has been shedded into their saliva, they use it, and use it immediately, you stand the risk of getting infected. Okay, so that's a non-sexual transmission of the virus. In oral herpes still. Oral herpes, the way it works is it can also infect the genital area.
Okay.
So remember I told you that there is genital herpes. There is also oral herpes.
Yes.
The virus which causes oral herpes, can also cause genital herpes.
Okay.
So, some time ago, I made a post educating people on this, that it's important that when you have the blisters, because the oral herpes is the commonest. Up to 4 billion people in the world have oral. It's very, very common. Extremely common. So when you have that outbreak of blisters and you're touching it, you stand a risk, particularly in men, of transferring the virus from the mouth when you go to pee, and contaminate or, transfer the virus to your genitals, and you can become infected. Which is why we emphasize that if you have it, avoid touching, or if you touch, make sure you wash your hands carefully, properly with soap and water before you handle other parts of your body.
Okay, so how can you diagnose this? How do you know when you symptoms start to show? Because I think some don't even show symptoms at all. So as regards to two types, how do their symptoms present itself?
Okay, so it's true. Most cases of herpes infections are asymptomatic, meaning they don't show any symptoms. And that's one of the challenges with, prevention. The average person there has herpes, but you won't know because they have never presented with symptoms, clinical presentation symptoms. They have never done that. About 80% of people with herpes don't show any symptoms. They're asymptomatic. Okay, that means if you have 10 people here, 8 people actually have herpes.
Wow. Whoa.
Okay.
That's very interesting.
That's scary.
8 people have herpes.
Wow.
About 67% of it is caused by type 1, that is the oral herpes.
Yes.
So that's the commonest one.
That's type 1.
Yes. While the other 13 to 15% is caused by, is the genital herpes.
Right.
So, but still, there are times when it can present with symptoms.
Yeah.
Okay. And usually when it's presenting, it's the rash.
Right.
So we can make a clinical diagnosis, what we call spot diagnosis. So a patient comes to us, complains that, okay, they have this burning rash that has been there for like 2-3 days. It's already burning, tingling, it comes, or it's repeating. It comes and goes, but the same location. It comes and goes, and, then we'll take a look at the rash. A doctor who is sound enough will be able to make a diagnosis of, herpes.
Yeah.
That's a clinical diagnosis that you can make. Then there's also the laboratory that you can make, where you can actually go to the lab and get tested. So there are blood tests, that you can check for antibodies against the herpes virus. You can also do a culture. Okay. So assuming you have the rash, but you still just want to be sure, you can go ahead and get tested and, you confirm your diagnosis.
Okay.
Even in people who don't have the rash, if you do some of these tests, it will show that you actually have herpes.
Yeah. So very interesting that you said 8 out of 10 people have. That means only 2 people are safe. So my next question is considering that large a number or that large the difference in a ratio, how life-threatening is herpes?
Okay. Luckily, it's not so common when you see herpes, being fatal. It's not a common thing, at least in most adults who are healthy. However, there are instances when it can be a bit complex to manage. So, for example, in people who are immunocompromised,
right?
Somebody living with HIV and AIDS, the person's immune system is already compromised. Such a person will probably not do so well managing the disease. Okay. We'll have something we call disseminated infection, where the virus can get disseminated to distant organs. For example, like brain, it can get disseminated to the brain and cause what we call herpes encephalitis, which can become life-threatening.
Oh my goodness!
That's one case where you can you really mess up somebody's life.
Yeah.
Then there's also the instance where an infant or not an infant now, a neonate, particularly a neonate.
Okay, what is that?
A neonate, a child that is under 30 days of age, can get infected.
Okay.
Once a child of that age gets infected, it becomes like a life or death situation. They do very, very poorly, okay, especially if they don't get immediate care. And it's one of the reasons we emphasize that when mothers give birth to their babies, they make sure that it's not everybody that just carries their baby and starts kissing, and, because most of them, eventually, they get it through, strangers touching and all, kissing and, all sorts. Even the mothers themselves will advise that if you have herpes, okay, and you have an outbreak, particularly around that time you are giving birth, don't kiss your baby.
Yeah.
Because the more you kiss, the higher the... And the funny thing here is, the way it works, you don't actually have to have the blisters present before you infect someone. So even without the blisters, you can still get someone infected. Just that the risk is more when you have the blisters, the rashes. Okay.
Wow.
Okay. Now, one thing that is scary is the fact that for someone that is asymptomatic, that's not presenting symptoms, or is not even sure, you're not even sure if you have, then how can you be careful not to infect someone else?
You see, this is where the challenge of prevention comes in. Okay, and the funny thing here is there is no vaccine. Sadly, there is no vaccine for herpes, though there are, one or two efforts being made, to get something, but nothing substantial yet. Okay, so it becomes very difficult. And since most people are asymptomatic, it's hard to actually tell. Some people have never had any symptom before, so they can't. If you ask them that you have herpes, they'll tell you no. But if you run tests, you actually won't see traces of the infection there. Now, for those people who actually have symptoms, who know that, okay, yes, I have herpes, sometimes the responsibility of prevention lies on them. Okay? What do I mean? If you have cold sores, right? I can see your cold sores and be able to know that, okay, this person has herpes, so I need to be careful. Maybe that will not be a good time to be kissing the person, exchanging bodily fluids. However, if somebody has genital herpes and there is a rash there, how will you be able to know? By just looking at the person. Except the person comes to you and lets you know that they actually have this. So sometimes we advise that if you have an outbreak of the blisters, especially in couples, when you see a situation where one of the couples has the virus, the other person is negative, we advise that to reduce, the risks of transmission to your partner, avoid sexual or even intimate contact around the time when you have an outbreak of your blisters. Very, very important. Okay, then again, you yourself, you can go the extra mile of ensuring that, it's not just everybody you see you kiss or you start making intimate contact with, we do this a lot in our environment. You use somebody's spoons, a total stranger, you just take the spoon, and start eating. Those are things that you may want to, pay careful attention to.
Yeah, all right. So considering now, okay, so we've spoken about background, we've spoken about symptoms, we've spoken about causes, we've now spoken about management. So I want to go into treatment, all right? Now, it seems to me that, now you've said that there's no vaccine and there is no cure as well, isn't it? So that means once a person gets herpes, that's like a life sentence, all right? So how can it be treated?
Okay, so before I get into treatment proper, let me just explain something quickly. There are like maybe 4 causes of the infection. So there is a primary infection. Okay, that's when you actually get the first symptomatic manifestation of the disease. We call it primary syphilis. I'm sorry. Syphilis is coming to my mind. We call it primary herpes, right? Now, it's usually worse. The symptoms are worse. The first clinical manifestation is worse. The pain is severe. You may have other constitutional symptoms like fever, swollen lymph nodes, fatigue, stuff like that. Then there is another phase of the infection that we call latent or dormant phase, where the infection becomes dormant. It does not cause clinical symptoms, no clinical symptoms. So most people that get infected, right, they may actually not even witness the primary infection. It just goes straight into the dormant phase, where the virus just remains dormant, no infection. But occasionally, it gets shared and comes out and somebody can get infected. That's why I said people who are not showing symptoms can also infect other people. So that's the dormant or silent phase. Then you now have reactivation or recurrence, where you have outbreaks. And that is typically what we see in people who have symptoms. So like this year, you might have 2 or 3 outbreaks. Same location, the blisters come out, and you experience pain and, and all the other symptoms. Then you now have complicated infection where it has spread to the brain, it has affected the eyes, stuff like that. Now, depending on the stage you are, treatment will be tailored to address the particular stage. So, for example, if you have maybe a primary infection, there are antiviral therapies that are given, to reduce the viral load and also clear subsequently the rash is going to resolve. They'll give you painkillers for that and all. Then again, if you are having a recurrent infection, because some people can 5 times in a year, they have so it becomes problematic. Why there are others after the primary infection, 5 years, no issue.
Nothing again.
Then there are those that, especially people who are immunocompromised, going through stress, people who are, malaria, stuff like malaria, high temperatures, pregnancy, they can trigger outbreaks very easily. So for those people, we have what we call a suppressive treatment, where we give them a protracted course of antiviral therapy to bring down the load of the virus, so that they can achieve some level of relief, maybe like 2, 3, 4, 5 months of relief, rest before they have another one. Okay. There's also what we call anticipatory treatment, where, instead of you waiting for the rash to come, you attack it. Wisdom. You have to apply wisdom. The thing is attacking you like 5 times in a year. You have to apply wisdom. And sometimes you could actually tell that this is about to happen. You could start feeling the tingling sensation. So you could actually start, therapy, anticipatory therapy. You reduce the severity of symptoms and you help yourself. Or you could actually even do prophylaxis. So intervally, let's say every 3 months, you can be taking the antiviral therapy just to bring down the load. Because there's a critical mass, or critical level above which symptoms manifest. Right. So if you are taking the antiviral therapy regularly or occasionally, you keep the viral load down. So that you'll be able to, experience some level of relief. And if it's complicated, aggressive. Complicated, life-threatening, so you have to be very aggressive. Sometimes we give IV intravenous drugs.
Wow.
So instead of tablets or creams, we push drugs into the veins
system,
and pray that the person survives it.
All right.
So, sorry, I want to be clear. So I want to know if there is a link between poor hygiene and herpes. Like, can it cause it?
Yes. So one of the risk factors of herpes is low socioeconomic factor, low socioeconomic class. So people who are from, not so well backgrounds where things are hard, they are more likely to, to get it. They are more likely to share spoons. They are more likely to sleep on, pile themselves up, touch them, and stuff like that. So that has a link.
I'm actually learning so much this morning. All right, so HSV2 and HIV, is there a similarity? And if there is, what is it?
Okay, so the thing here is HIV is, causes AIDS eventually, AIDS eventually. Then herpes is different. So there are two different infections, but they are viruses. However, I mean, there is a link, in the sense that if you have herpes, genital herpes, it can slightly increase your risk of contracting HIV if you are very reckless, sexually reckless. It can increase your risk of contracting STDs, other STDs, including HIV. And of course, if you have HIV, you are more likely also to suffer severe symptoms when you have herpes. You can have, herpes encephalitis, where it gets to the brain, gets really bad. Okay, so...
All right, so now I want to talk about local remedies. All right. I know...
I beg your pardon?
Local remedies.
Okay, sure.
All right. I want you to talk about the role of local remedies. I know a lot of medical practitioners or professionals do not like the idea of local remedies. So, are local remedies, can they be efficient or effective enough in dealing with herpes? So, I'll give you an example before you go on. I know palm oil can dry up a herpes. So, it's like, as a form of cream to mitigate the rashes. I know palm oil dries up herpes. So taking that, for instance, as a case study, what is the role of local remedies?
So the thing here is, now the thing with herpes is, even if you have an outbreak and you choose not to do anything, at the appropriate time, it will resolve.
Okay.
It's just that, can you bear the pain?
While it lasts.
While it lasts. If you choose not to do anything, fine. Just wait for it. 2 weeks, 3 weeks, it goes.
Wow.
Okay? Your immune system will find a way to, if your immune system is competent. Okay? That's that. Having said that, the role of, herbal therapy is possible. It's possible herbal therapy could work. It's possible.
Yeah.
I don't know of any specific one, but, if you find something that's working for you, fine. However, I should emphasize this because this is where, sometimes people, mix things up. Treatment is different from cure. Okay? As of today, as we know, there is no cure for herpes.
Yeah.
If there was a cure, even if it is herbal, people will not be having malaria blisters or cold sores. You keep having it. All you do, you take your whatever. Some people take herbs and it goes. But at the appropriate time, when there is stress or you have a malaria, it comes up.
Yeah.
So that just tells you that there is really no known cure. But there are diverse ways you can manage the symptoms, when they come up. And that may include herbal therapy as well.
Right.
So if you find something that's working for you, it's all good.
Yeah.
We all want you to be healthy.
All right. So on a final note, I want you to encourage our viewers this morning on the necessity of good hygiene and irresponsible sexual health. So, that is your camera. So you can just look directly at them and just encourage them.
This is something that is very important and cannot be overemphasized.
Yes.
The importance of hygiene, keeping a good hygiene, especially now where we have, the whole third wave of COVID-19 and all.
Yes.
The importance of maintaining proper hygiene cannot be overemphasized. Okay. Having said that, let me emphasize on sexual health. You made mention of responsible. That's the terminology.
Yeah.
Responsible sexual practices or sexual health-seeking behaviors. It's important. Recently, there was a news publication, that there is an increase in cases of HIV.
HIV, yeah.
Yes. That means there's an increase despite the awareness, despite the fact that condoms are so cheap, protection is so, people are still being sexually reckless. And it's called, let's even take aside HIV. There are other, for example, HPV, human papilloma virus. It causes genital cancers, penile cancer, vulvar cancer. It can even cause anal cancer. For those who practice anal sex, can cause cancer of the throat. These are all infections that you can have without even knowing. They might just be there, they'll fester for a period of time and increase your risk of developing, What about hepatitis? Hepatitis B, C. These are infections that, they are as deadly as some of these big names will call. But people don't pay attention to this. They're all looking out for HIV and stuff like that. It's very important. And of course, we cannot rule out the possibility that you can get pregnant or father on unplanned pregnancy.
There is that.
Okay. And of course, given that abortion is still considered illegal in our environment.
Yes.
You may resort to, patronizing quacks and increase your risk of suffering complications.
Very
dangerous. So these are some of the issues. Sexual health. And, in our own case, it's very peculiar because over 50% of our population are young people, and young people love sex.
Right.
Hormones are raging and stuff, so they want to experiment. They are also more likely to take risks, try anal sex, do drugs, stuff like that. Yes, all of these can increase. So, while one cannot tell people to not have sex, it's important that as you do it, you are responsible. You pay attention and you look out for your health.